What have you seen in your practice to be most effective in helping people with bone disease and helping them understand the importance of preventing fractures?
It needs to be a comprehensive, usually multidisciplinary care initiative to try to make this happen. The first thing is to identify yourself whether you have osteoporosis. The National Spine Health Foundation has a lot of information on their website, and I urge you to go to that, about how you can diagnose yourself, or at least start the discussion of the diagnosis of osteoporosis. So I would urge everyone to take a look at the educational materials about that. But from my perspective as a spine surgeon, we need to screen patients for osteoporosis. And some of the tips that are easy to identify: if you've had a fracture after the age of 50 that was relatively low injury, low energy, such as a fall from a height or fall out of bed, or even in the case of a spine, a lot of times it's just lifting a heavy object can cause spine fractures. That's a good indication that you likely have osteoporosis, and it's also a very strong predictor of bad outcomes from spine surgery. Another one is if you've had a parent with a history of a hip fracture, significantly increases your risk of fracture. There are a number of medications that are harmful to bones. The most common one that we see are people who are on sustained corticosteroids. The drug is often called prednisone. It's used for a variety of conditions, and that drug significantly causes osteoporosis and poor outcomes with spine surgery. And there are many other conditions. And also, there are specific criteria that primary care uses to determine if you should be screened for a bone density test, which is called DEXA, D-E-X-A. And this test will determine your bone mineral density, also calculate your future fracture risk. There's certain criteria that are used to determine that, but some rough ones are if you're female over the age of 65, male over the age of 70, or if you've had a fragility fracture. Those are all good indications to have a DEXA screening before surgery. So that's the first step, is to be screened. There are other techniques that surgeons can use to also help us, but those are the simple ones that patients should be able to understand. Next is, what do you do if you are diagnosed with osteoporosis based on the DEXA test, as well as other things that are related to your history? Well, then you need to be referred to a bone health specialist or the surgeon. Also, some surgeons are able to do this themselves, but more typically you're referred to a bone health center, and that can be a medical doctor such as endocrinology, rheumatology, or more commonly today is fracture liaison service, which is a multidisciplinary team which takes care of further assessment of your bone health. And then there are medications that can reverse this and mitigate the surgical risks that we're talking about. Another possibility is to go through your primary care doctor, but oftentimes we found that is not always that effective. Primary care doctors aren't used to prescribing many of the more potent medications that we use for this, and so oftentimes the treatment there, particularly in the preoperative patient, is not optimal.